Warning, this podcast has stories of real-life events and true crime that happens every day. These stories may contain adult language and graphic or disturbing details not suitable for everyone. Listener discretion is advised. In our society, most people are content to go through their daily lives safely and peacefully. But our society is not always safe or peaceful. For that reason, some men and women answer a higher calling to defend and protect their fellow man. You probably know someone who is one of these people, or maybe you are one of these people. The ones who see and do the things most people would never want to. These things are sometimes heroic and beautiful, but often they are horrific and terrifying. It's these things they don't share about with other people. It's these things they carry with them, so you don't have to. But when they get together, they talk to each other about them. And they call these stories war stories. Welcome back for another episode of the War Stories podcast. I am Tom.
And I am John.
And this is another...
We are here again.
Another day in the War Stories official bunker, also known as your house.
Yes. It's lovely.
And we've actually got someone for this episode that I thought to reach out to just because we had been asked on multiple occasions about some issues relating to trauma and police trauma and military trauma and PTSD issues. And we've talked about our own struggles with, things that we've experienced. Plus we've had a lot of people sitting here discussing, issues with stuff that they've experienced. So I just happened to have the name of a doctor on file that I reached out to, just crossing my fingers, hoping he would say yes, and he did. Hello, Dr. Mark Sergi. How are you?
Good to see you, Thomas. Good to see you, John.
We reached out to you because we're getting questions that we, I guess, can answer from a layman's personal experience perspective, but not from a professional perspective.
Sure.
And because I know that you have had experience dealing with this, I thought I'd see if you could maybe come on and give the expert opinion. But so that people that are listening understand the expert we're talking to, can you please tell us a little bit about yourself and your background?
Sure. I am a professor of psychology at California State University in Northridge. I've been a professor there since 2000, so this is my 20th year teaching at the university. And I'm also a in private practice. I'm a licensed psychologist as well. And in my clinical practice, I see people with many issues, depression, anxiety, but also PTSD. I've seen veterans, police officers, victims of sexual assault, victims of domestic violence. I've seen many forms of trauma and worked with those trauma survivors.
Now, do you see a commonality, would you say? Obviously, for it to be a diagnosis of PTSD, I guess that's a good place to start. What specifically are the symptoms, or how would somebody recognize if they might be experiencing issues with PTSD?
That's a good question. The diagnostic criteria for PTSD are very demanding. They're very They require a lot of symptoms. There's like 5 different tiers, and you got to have so many out of so many in each tier. What many people don't know is that PTSD, post-traumatic stress disorder, has a little brother. Its little brother is called acute stress disorder. Have you guys ever heard of acute stress disorder?
No.
So when a trauma occurs, the PTSD-like symptoms that may be going on, like nightmares, distressful memories, all the symptoms of PTSD, if they're going on day 3 through day 30 post trauma, and there's a sufficient number of symptoms, then it's called acute stress disorder. That's day 3 to day 30. No matter how severe the trauma, no matter how severe the symptoms, the diagnosis would be acute stress disorder. Then, after one month post-trauma, then we start to consider the diagnosis post-traumatic stress disorder. That's why it's used post-traumatic, is meaning that the symptoms are continuing 1 month post-trauma. And so we only start to consider the diagnosis post-traumatic stress disorder after a month has passed since the trauma.
So is that kind of like taking into account that everybody's going to have a stressful reaction after a traumatic event, and therefore in that first 3 to 30 days, it's normal to have that kind of thing, but it's when it's not dissipating after
Correct.
30 days? Okay. That makes sense.
Correct.
Interesting.
Not everybody, but a higher percentage of people. If, let's say, there's a mass shooting, like the one that happened in Las Vegas fairly recently, that you would expect there would be high rates of acute stress disorder for those persons that were involved, but then there would be lesser rates of PTSD. That for those persons who were involved, a significant percentage, maybe up to upwards of 50%, might show signs of acute stress disorder. But then once you go past a month and start to consider the diagnosis of post-traumatic stress disorder, then those numbers might drop down to 15% or so.
Okay, so it's more common for people to have acute stress disorder after a trauma and then have it dissipate, and less common for it to then transition into PTSD, full-blown PTSD.
Exactly, and acute stress disorder is the only diagnosis that you can diagnose in that first month. You can't diagnose PTSD in the first month, but you have to wait till 1 month has passed, and then you can diagnose PTSD.
Okay,
Interesting.
what would you say? I mean, are there percentages like 80% of people that experience acute stress disorder don't progress, or is it how does that work? That people who have acute stress disorder, then you're going to reevaluate them on day 30 once the 1 month. Once they reach that 1 month mark, then you're going to reevaluate them for the PTSD diagnosis. The PTSD symptom criteria are far more stringent than the diagnostic criteria for acute stress disorder. There, it's lesser symptoms are required. If you just have, I think, don't quote me, but like 9 out of 14 symptoms, you can get the acute stress disorder diagnosis. For PTSD, the symptom criteria are much stronger. I brought them with me here because I'm a professor and kind of anal about it. So we would love to hear, if you can, just tell us what the criteria are.
Sure.
For PTSD?
Yes.
Yeah.
Okay. Let's see. Let me. Sorry, there was a noise at the door. Probably just my wife just clicking around.
It's all right if you hear a noise in the background here. It's John's dogs clicking around.
Sorry.
They swarm around us like a couple of land sharks.
I'm as I mentioned, you could think of there's these many hurdles to cover or to clear. The first hurdle is that the person has to have experienced what psychiatry considers to be a true trauma, a true capital T trauma, versus what lay people might say. Many people, again, they would say last month was so traumatic. I had to deal with my parents getting, my mother was in the hospital and my girlfriend broke up with me. It was traumatic. But that is not a true capital T trauma. In psychiatry and psychology, a true capital T trauma involves exposure to an experience where your physical integrity is directly threatened, or the experience or the physical integrity of another person is directly threatened. So it could be that it's direct experience or witnessing. For example, if you were driving in a car and there was a massive bad car accident, the driver or the people in the car that would be a traumatic experience for them. That's direct experience. But also somebody who saw the accident on the sidewalk and came and had to deal, with the injuries that were of the accident, that could be a trauma for them. because they're seeing people who are gravely injured. Also, the first responders, the fire officers, police officers, who see the people who are injured, bloody, or unconscious and that would qualify as a trauma for them as well. So it's either direct experience, witnessing a trauma. There's also some exceptions like witnessing or learning of the sudden death of a loved one, a friend or a family member. Like not a scheduled death, not like you have a friend in the hospital and he's had a terminal illness for a long time, then he finally passes away. That would not count. But rather, if Uncle Ted was Uncle Ted, you get a call in the middle of the night, 2 a.m, and you answer and it says Uncle Ted died in a car accident, and that sudden learning of it, that would be a trauma. It would be the learning of it would be the trauma.
Okay.
Yeah. And the DSM, the Diagnostic and Statistical Manual of Mental Disorders, the 5th edition, that's the current edition, it was revised to include first responders and even police officers, fire officers, and even trauma counselors as being aware that these persons will experience trauma.
So according to those criteria, if a firefighter goes on a 72-hour shift where he's living at the fire station for 3 days, and in that 72 hours he goes to 3 fatal accidents, CPR on an infant baby, and a structure fire where the whole family is burned, those are basically 4 capital T traumas in 3 days for him.
You bet. Wow. You bet. They would qualify for that, sure, except there's a little bit of it. We need to go with if that's his normal, he may not be affected, especially if he's a veteran firefighter. He's seen it a lot, unless he sees something exceptional. Like imagine somebody is an emergency room physician, and when they're doing their residency as an emergency room physician, they might see their early experiences of horrific things might traumatize them, might cause them distressful memories, cause them nightmares. And then after they have those experiences again and again and again, they're better able to cope with it. But at the same time, the accumulation of those traumatic experiences can affect them. So what's also true is what's traumatic for me may not be traumatic for you because of your experiences. Like for a fire officer might arrive on the scene and there's all sorts of horrible things that they're witnessing, but they feel in control because they know exactly what to do. Same with a trauma surgeon knows exactly what to do. So they feel more in control of the situation versus a layperson. That'd be very traumatic for a layperson.
No, so I guess when I'm listening to you talk, I guess for me, I'll just use myself as an example.
Okay.
I didn't start having symptoms until I would say a good, decent time after my deployment. And I guess my question would be, what's happening in that buffer?
That's a very good question that I can't quite answer, but delayed onsets are not uncommon. Probably the most, so delayed onsets like you described are not uncommon. The most remarkable occurrences of delayed onsets would be like, I heard stories of World War II veterans who started to have an onset of their PTSD symptoms when their spouses passed away. So 50 years removed from their combat experiences, and their spouse passes away, and they start to have PTSD memories of when their buddies died, when their buddies left them.
It's almost like a trigger.
Yeah.
Yeah, I'd heard about veterans getting triggered by, and I really hate that word. I know there's nothing wrong with the word, but it's just overused.
It's overused by young people, but we can use it legitimately here. I think.
I was going to say this is like the one time you can legitimately say it. They talked about veterans that would go see Saving Private Ryan, or they would see Platoon. And if they were a Vietnam veteran or they were a World War II veteran, just they were support numbers set up, because I guess some of the veterans were leaving the theater in literally in tears and just.
That's right. Well, exactly. Yes. Saving Private Ryan was so realistic. It caused a lot of people to have memories. I remember my grandfather who saw the movie. He was alive at the time, and he was a World War II vet. He related to the experience of not wanting to leave his buddies because he got malaria and had to leave twice. Had to leave New Guinea twice, and he really affected him to see remember in Saving Private Ryan, he had to leave.
Yes. Yeah.
Because all his brothers were dead, and that concept, having to leave your buddies, really affected him.
So,
and it was 50 years later.
Is that would you say it's because you've kind of dealt with it, or maybe you haven't dealt with it, you've just set it aside and been able to move past it, but it's still locked away up inside there, and then that just releases it?
Yeah, that can happen. That would be a way of describing it, and I don't know anything more psychologically to explain why there can be a delay, whether that delay is 2 years or 50 years. Maybe it's just something where something about the experience, the current experience, pardon the word, but triggers the feelings of so many years prior. Like the example of a World War II vet who loses their spouse, and it brings them back to the feelings of losing a buddy in combat.
Right. So there's such a long time in between feeling that deep sense of loss that the finally the first time they feel it. I guess that would make sense, because I mean some people, some police officers or firefighters, they don't have they don't start to experience symptoms of PTSD until they smell the second time they smell someone or hear someone burning to death, or the second time they see. So it's I've talked to many guys that you experience it the first time, right, and then you do okay, but then the second time you experience anything that reminds you of it, all of a sudden, boom, now you're in it.
Yes.
Right.
And you were talking about like what a fire officer might see in a 72-hour shift. All that you described, boy, those are really legitimate traumas. Seeing people burn to death, seeing people maimed, seeing they're legitimate traumas. It's of course there has to be that the person experiencing has to have a sense of shock or horror in the moment where they're seeing it. You're kind of expecting that there's going to be a sense of shock or horror for what will later be considered a trauma. If a person arrives on the scene and they're totally in control, they know what to do. Maybe they don't feel a sense of shock or horror from the experience. But that you guys could speak to that.
Yeah, I would agree with that. I mean, it's I think when you've been doing a certain job for a long period of time, you show up on a scene like a shooting scene and you got a man down, and it's almost like no, I don't want to use the word calm. Calm's not the right word. But yeah, there's a detachment, but at the same time, it's almost like things now are just becoming fluid, and now they're working, and we're just going to continue, and there's really no thought in what we're doing while there's sheer panic around.
Right. Well, I mean, we've talked about it. One of the common things that we say is both firefighters and police officers and veterans to some extent, when you're dealing with people, overseas in a war zone or here domestically on a police scene or on a firefighting scene, you're dealing with them on what is arguably and probably the worst day of their life in many instances. That fatal car accident to them, that is the worst day of their life to that point. But for you, it's Thursday.
Right.
That's exactly right. Exactly right.
Well, since we're talking about prolonged exposures and the different types, or not different types of PTSD. What was the first one? I'm sorry again, sir.
Acute
trauma syndrome. Acute trauma.
Acute stress disorder.
Acute stress disorder.
That means the first month since
Correct.
the trauma. From day 3 to day 30, we evaluate for acute stress disorder. If it's been 1 month since the trauma, then you're evaluating for PTSD.
Okay, and then so then this will bring me into my question that we've had from a listener, because this is something that myself and Tom have not heard before, and I'll ask you and see what you have to say. So this listener said, I've been hearing See Ptsd, which I assume is supposed to mean chronic PTSD from prolonged exposure. Is there a difference in treatment between PTSD and See Ptsd?
That was Amanda Powell sent that?
Yeah. And then she goes on to say I would think law enforcement and military would have had a longer exposure to extreme situations. So is CPTSD a diagnosis? So I guess it's a two-parter.
It's a specifier. It's a specifier that it would be PTSD, complex versus PTSD, simple. A simple PTSD experience would be that somebody has a single episode of trauma. It was one car accident, one sexual assault, versus somebody who's been sexually assaulted 5-10 times. Perhaps a prostitute, for example, or a homeless person who's been beaten to the point of being near dead 5-10 times. That would be complex because it's been experienced multiple times. That was one issue. They said prolonged.
Yeah, she said. Here, let me go back to it real quick. My phone's cracked. Sorry. Yeah, she basically said, I assume CPTSD, which I assume is supposed to mean chronic PTSD from prolonged exposure. And then she goes on, and then she asks, is there a difference between the treatment between PTSD and CPTSD?
Basically, no.
Right.
Is that there's no difference in treatment.
Got it.
Whether it was a single episode trauma or it was multiple traumas, other than the fact that in the exposure therapy, that you'd be seeking to have the client discuss all the traumas, or as much detail about all the traumas as they can. At some point, I'm sure we'll get into exposure therapy for persons with PTSD.
So, I guess let's get into that then. What is the treatment or the typical treatment regimen for post-traumatic stress disorder? You always hear the term cognitive behavioral therapy, or I guess CBT to some people. Yes, what does that entail?
And I've been teaching courses in CBT for 15 years, so I think I could speak well on that. CBT is an overarching term that just means therapeutic strategies that consider cognitive and behavioral factors. Basically, the basic cognitive premise is that cognitions, thoughts, affect our emotions, affect our behavior. And that from that frame, that's the school of therapy, cognitive behavioral therapy. There's basically three major schools of therapy. Psychodynamic therapy, like Freud and Jung. And then there's humanistic therapy, which is basically, counseling for people who have everyday problems. And then the third area, or the third school of psychotherapy, is cognitive behavioral therapy. And there's lots of different CBT strategies, different CBT interventions that are used. Exposure therapy is an example of a CBT strategy.
So that would be if you have somebody who is deathly afraid of heights, and slowly but surely you take them up, an escalator or an elevator, and you like little by little you expose them to heights. Is that exposure therapy?
Well,
because nobody's shooting at me again. I'm just saying.
Just because I'll talk about it like a professor, but interrupt me if I get too boring.
Okay.
There's two approaches to people who have been who need to be to overcome an anxiety. One is called systematic desensitization, and the other is called exposure therapy. They both share in common that the person's going to be exposed to elements of the trauma or the upsetting experience. Because sometimes it's a trauma, other times it might be just they're afraid of dogs, so they need to get exposed to progressively larger dogs. But in the exposure therapy approach, the objective in treatment is to maximize anxiety and have more complete exposure of high detailed exposure, and that can occur right off the bat in traditional or classic exposure, or graduated exposure can be used, which is more common, where you start with lesser elements of the trauma, but still scary stuff, and you go to progressively more scary events, more disturbing events that the person remembers. But you do it in a graduated way. That's graduated exposure, because you're starting with, let's say you put certain experiences in bucket number 1, more scary experiences in bucket number 2, yet more scary experiences in bucket 3, and then finally bucket 4. You're going to talk about all the experiences in bucket 1 first, then 2, then 3, then 4.
So you kind of take the easiest ones first.
Yes.
And that is the graduation as opposed to...
Yes.
Okay.
Yeah. You're moving in a progressive way. That's exposure therapy. In SD, systematic desensitization, it's different. You're looking to have a person be perfectly relaxed as they discuss all the traumas or experiences they went through. That's used less common with trauma. It's more commonly used with people with phobias and stuff like that.
Okay, so that's the, little bits at a time, and you keep them calm and have them work their way through it, kind of an idea?
Yeah, you keep them perfectly calm, and you start with very simple little experiences. Like if a person's a dog phobic, they would start by looking at a picture of a dog from 20 feet away,
Okay. Huh.
And then they go up step by step, and at every step they got to be perfectly calm. And you work step by step to finally get to step number 25, the scary stuff, like a big dog that's growling,
And then if they can, so do you have to walk somebody back like step by step till the point where they were calm again if something freaks them out?
Yeah.
Okay.
Yes. If someone's at step 3 and they're now looking at a picture of a dog from 5 feet away, they would raise their finger, and then the therapist would take away the picture, and they would go back to do their relaxation procedures. They would do their diaphragmatic breathing to calm themselves, their progressive muscle relaxation, tightening their muscles for 2 seconds, then relaxing for 5, so they can calm themselves. And then when they're calm, they go right back to step 3.
Okay. So I guess in cognitive behavioral therapy, it really is about processing it and staying calm as opposed to anything else. It's just trying to deal with it.
And both systematic desensitization and exposure therapy are cognitive behavioral therapies. They're just 2 different forms of CBT, because CBT, there's a boatload of CBT. Assertiveness training is CBT. Anger management is CBT. Exposure therapy is CBT. Dialectical behavior therapy is CBT. These are all just the therapies designed for specific disorders, but they're all considered CBT.
So basically anything that modifies behavior or response to behavior.
Anything where the foundation of the therapy is the belief that cognitions play an important role in affecting behavior and in affecting emotion.
Now, you kind of we have a longtime listener, Rob, who sent us a question. It said, "Why are some people able to be involved in and witness traumatic incidents and be totally unaffected, while others get messed up? Is it upbringing, religion, or just natural ability?"
That's a good question. I wish I had a great answer. There is some research to show that there are temperamental, meaning just genetic. Some temperaments can handle trauma better than others. A person who, like myself, has anxiety, I've never been traumatized, but I'm just a generally anxious kind of person. Makes me a good worker and all that. But if I would not be the kind of guy who would do well as a cop, to be honest. So temperamental reasons. Some people can just, genetically, be more resilient than others when it comes to trauma. We also know that people who've been traumatized in childhood are more subject to trauma later. Meaning, if someone has been traumatized when they were a kid, and then they're traumatized in combat at age 26, they're going to feel the effects greater because of their childhood abuse.
Do you think that can also make them do the job better?
That the childhood abuse can make them be better?
In a sense of what I mean by that is, if the abuse happened early on in life, and then you put them in a wartime setting, do you feel they're maybe not? I don't know what's the word. Maybe perform better. Maybe it's just not the same psychological effect so quick because of the things they've
I see what
dealt
you're saying.
with.
So instead of like it's a kid who's never experienced trauma in their life, and they get to a war zone and they freak out and freeze. You have a kid who's experienced trauma as a child, so when they get to a war zone,
it's almost
they're
like
a little more
prepared
prepared for it.
That would be an inoculation hypothesis, but that's typically not borne out. The literature doesn't support like this. You're suggesting an inoculation hypothesis, but the research does not bear that out. Most commonly, people who've been abused or traumatized in childhood, their coping skills are poor, and they really struggle with future life events, traumas, and even general stressors.
Sure. Yeah, that makes sense.
But in the moment, I guess, are they less likely to freak out in the moment, even if they are more likely to experience a traumatic reaction later, do you think? Or
that I don't know.
Okay.
That I don't.
Okay. Because I think that would be an interesting thing to see if they're more capable of, because of nature versus nurture, right? I mean, I know there's certain parts of my personality where I've always been able to kind of logically detach from a lot of things and look at something in a somewhat cold-hearted way. But at the same time, I got a lot of deep feelings about things, and there's, with my kids or with, some movies or whatever. And it's weird. I actually just talked, let me ask you this. Okay. This is totally this just came to me. So if I don't ask it, I'll forget. I spoke to another police officer who we were talking, and we both admitted in front of a group of people, we were like, oh, I cry at movies. I'll totally cry at movies. Like that's what like if I watch a movie and something happens to the dog, or something emotional or something cool, like I'll get a little teary eyed, and everybody look at me like, oh, you're getting, and I looked at him and I'm like, yeah, but when we're on the job, like I can handle dead babies and I can handle all this other stuff in the moment. But you put me in I said, maybe it's because like a movie is a safe place where it's acceptable for us to show emotion. So that was my hypothesis, but I thought maybe you had
almost in the movie theater, you allow yourself to do that. In the job, you go in the situation with a harder shell, I guess. In the movie, you're enjoying the full experience, and part of that is allowing your emotions to be. That's what we go to movies for. To laugh, to cry, Yeah,
because I do have a friend, a different friend, who says when they need to cry, they will pick in the theater listings the most emotional movie they can find, and they will go and sit in a dark theater and just bawl their head off watching this movie.
That's wild.
Because they don't ever, like, they have a hard time crying. And they don't like to do it in front of people. And, if you're in a dark movie theater where everybody else is emotional, it's completely socially acceptable to have that sort of reaction. And it's a weird, but it makes sense to me, I guess.
Mm-hmm. Yeah, I would agree. We go to the movie theater because we're looking for an emotional experience. We want to laugh. We want to cry. Maybe in one movie we want to do all, both. But I would say, how is it that a veteran, a police officer, can be tough on their job, but then go to the movie theater and let out their emotion? Maybe because they've learned that that's the best way of coping with their job.
So it's like the little steam release valve where you can find a safe place to ventilate and not.
Exactly.
Oh,
yeah,
that's interesting.
Perhaps. We're just speculating here. That's I'm not.
Sure. No, yeah, I'm not. Yeah. We're not going to hold your feet to the fire on this. But so one of the other things he asked was genetics, but also upbringing and religion. So we covered upbringing because kids that.
If you don't mind, I have a couple words about genetics.
Sure.
Very easy to understand. We were talking about people who were physically abused, emotionally abused in childhood, can be at greater risk of PTSD for if they were traumatized in adulthood. But it all depends on their temperament. We can all understand that I know this is very broad strokes, but think about Chihuahuas versus Pitbulls. If you have a Chihuahua that's beaten as a puppy severely, it's going to be an anxious Chihuahua. Conversely, if you have a Pitbull that's beaten as a baby, as a puppy, it will be a very aggressive Pitbull. So physical abuse can turn some people into social workers and others into sociopaths.
Interesting.
Oh, yeah, that's a good way to look at it.
Yeah, I've never heard. That's as good of an analogy as I can think of. Because
thank you very much. Based on temperament, some people have a temperament where the horrible abuse, could make them into a sensitive person, an empath, and a therapist. And others, it turns them into a brute.
So it's interesting because there's so many things we can talk about in today's society and rabbit trail on if we really wanted to, but we won't, where the trigger or what makes person A this and what makes person A or person B, they both go through the same thing. They both are raised the same way, but they come out completely different people. It's almost like the idea of they're different breeds of human in some respects as far as their temperament.
Yes.
That's interesting.
Different, but you can see different temperaments in siblings too. You can see the sensitive sibling and you can see the hard sibling.
I think this is probably why psychological screening in the hiring process is as important as it is. But I also think that this is why stress academies and stress basic training and those kinds of environments where they do what are quote unquote awful, mean things to you early on, it does serve a purpose, because it's better to find out 2 weeks into training that this is not for you than it is to let somebody like that get through the process and go out into the world and experience this awful stuff and ruin their life.
True. I agree.
So the next, we kind of went over these. So the complex PTSD, you were saying, is multiple big T traumas to the same person. Do they have to stem from different events, or could it be the same traumatizer just in different instances?
Yes, that would still count as complex.
Okay.
A young girl who was sexually abused from age 5 to 9 multiple times, that would be complex, obviously, even though it was one perpetrator.
Okay. So then, to go back to Amanda's question, then, is there a category or is there a specific idea involved in prolonged, repeated exposure to, I guess, even things that you're okay with, like you were saying, that's your job. You're trained to deal with these things. You're in control. But as a firefighter dealing with accidents and medical aids and stuff like that, or as a police officer dealing with gunshot victims or sexual assault victims, yes, you deal with that on a regular basis. You're trained to deal with that on a regular basis. But is there some point, or is there some other diagnosis, or is it the same diagnosis for the cumulative effects of those instances day in and day out over 20 years?
Yeah. And I would say, and even what are the lesser effects of seeing so much trauma or experiencing so much of the horrible part of life? It's not always PTSD. It could be other things. It could be that the fire officer or police officer who's now just more detached from their family and friends than they used to be, which is actually symptomatic of PTSD itself. Or maybe they're just more suspicious of people. They never, and this is part of coping with life. You tell me. You guys are the experts in police work. Tell me, how often is it true that police officers live in the communities that they serve?
I can tell you, I was told by my own father, "Don't shit where you eat." So it was.
Now, what do you say? Often people use that expression about dating.
Right.
He was saying basically, don't live where you work.
Right. He lived in the city of Santa Clarita and he worked in the city of Los Angeles. And a lot of cops live in Santa Clarita, live in Simi Valley, live in Thousand Oaks. Yeah. They live in these outlying communities, and they become known as, Copland, because you're able to commute into the city from this outer community. But
there's a protective factor there. They're because it's to be where most people consider safe, like Ventura Boulevard, Encino or whatever. Maybe that cop needs to be have a certain distance. He needs to be in
100%.
Yes.
Yeah, no, 100%.
Yeah.
I agree with that.
And I could tell you, I worked in the city I worked for was a small town of 30,000 people. You know, it was a small city. We did have guys that were tied to the community. They'd grown up there. They wanted to become police officers in that city, and they still lived in that city. And they would come into work and they would jokingly say, "Oh yeah, I was in the grocery store, you know, the other day, and I saw, you know, Tweaker Joe checking out behind me." And I'm like, You're insane. You're a crazy person. I would never,
Yeah.
I don't want to deal with that. I'll tell you what, I had an issue when I was working undercover narcotics. My daughter, I lived 30 miles away from the city where I worked, but I was on a county-wide task force. And I took my daughter, I was home and I picked her up from school. I can remember because her 5th birthday was approaching, and I went to pick her up from school, and she had this little best friend that she wanted to invite to her birthday party or whatever. And I said, "Oh, which one is your best friend?" And she points out this little 5-year-old girl walking along with her mother. And I immediately recognized her mother as a doper that we had investigated.
As a what bird?
A doper, like a dope user. And I immediately recognized her. And when we got home, I told my wife, and I said, we can't let this woman's kid come over to our house for Mackenzie's birthday. And I don't know how to tell my own daughter, "Hey, your little best friend can't come over." But there was no way I was going to bring that into my own home. And that was the danger of shitting where you eat.
Yeah, no, I agree.
And don't you also see, police officers, they're very, they're like, they look at you meet somebody at a party, you go to a family member's party, a friend's party, you meet new people, and you're kind of inherently a little suspicious, like, who is this person? Would I know this person? Even as a psychologist, if I'm choosing a babysitter, I'm going to be very, very, particular about who that person's going to be.
Right.
There's so much stuff during the course of your work.
Well, and you see people all the time, and they, that what they look like on the outside and what they're going through on the inside don't always match.
Yeah, exactly. And when you're so you know that just because someone dresses well doesn't necessarily mean that they're a rational person, or that they don't have a massive drug problem, or that they're not abusive of the people around them. It makes us all a little bit more guarded, I suppose.
Yeah, I can't even tell you how many times I've told my wife when she's like, "Oh, we're going to go with my friends and going to do this." And I'm like, I don't need new friends.
Yeah, I've got friends.
I'm good with that. Yeah. I have people I can trust.
Yeah. Well, okay. So another part of that is, being secretive. Whereas, if you're a veteran and you don't necessarily tell people that you were a veteran or that you were deployed, because what's the first question that any veteran gets asked when they find out you were deployed? Did you kill anybody? Or if you're a police officer, you say, "Oh, I'm a cop." And then the first thing you get is, "Hey, do you know so-and-so? Because he pulled me over and he was a dick."
Yeah.
Or, "I got pulled over the other day," or "I got arrested one time," and they want, your legal advice. So you don't tell them. And then that's another layer of, I need to separate myself and insulate myself. And the only people that understand me are cops.
And then unfortunately, you're separated from the people that you're supposedly serving and protecting.
Sure.
Sadly.
Right. Sure.
If everything was geared for a psychological effect, police officers on their off-duty time, or even part of they get paid for it, but they would go to community parties and out of uniform and be able to experience people who were just well-adjusted people,
Well, and go ahead.
To address this issue, because you're driving around the communities of LA, seeing people in extraordinary circumstances, shootings and all sorts of crazy trauma. You would need to get some exposure to people just who are in these communities, who are having a good time, who are just enjoying themselves.
Right, not at an awful moment.
Yes, and just experience them as people.
Right.
So one of my biggest issues still is that, I would say. I wasn't kidding when I said, like, I tell my wife all the time, like, I don't need to meet anybody. Like, I'm good. Like, I have a good solid group of core people that I love, and then I'm good with that. But I've found that the times that I have tried, there's nothing in common.
Right.
There's, like, my brain is almost just on another level, and
you feel like an alien a little bit.
Yeah.
I will often look at a room full of people having a conversation about something, and they're all enjoying this conversation. And I will listen to what they're talking about and literally go, you guys belong in a padded room with finger paint. I don't understand how you guys are enjoying this conversation. I feel so alienated from the conversation because it almost feels to me like they're living in a totally different world. And I think that's our problem, not theirs. I honestly do.
I agree with that. Yeah, I don't.
How would you describe that or label that issue for police officers or combat vets in terms of feeling different from the other person, that you feel different from the typical citizen?
Because our eyes are opened to the real world, and
what other humans are really capable of doing to other humans.
Yes.
Yeah, and really, you guys see so much. Yeah, it's really.
I had this conversation.
You can't escape the fact that it does affect you psychologically. Not necessarily PTSD for many, but it does affect the average officer, the average fire officer. In terms of how you see humanity.
So something that something that I've seen commonly in a lot of officers that I work with, and even more so, I think, in the military community, and maybe you could touch on a little bit, is memory loss.
Yes, because I wanted to actually, this will lead into, so I'll ask this question that I had sent the doc earlier. So can you explain the neurological changes that actually occur that cause these things to happen? Because from my understanding, it's kind of a reprogramming. I don't want to say rewiring, because it's not actually like changing the physical nature of your brain,
right,
but it is definitely changing the thought patterns and thought processes. So there's a rewiring or a reprogramming that occurs that ends up with things like memory loss or slowed time during the actual event, or during, a later on a traumatic, or I guess a triggering event, or an experienced event where you're like, you feel like you're sluggish and everything's going in slow motion, or, Jon and I have talked about this, Swiss cheese memory, even like the inability to make short-term or have short-term memory problems.
Yeah, my memory fucking sucks.
It didn't used to.
I feel like it didn't, but I don't remember. But no, but seriously, like my wife has to remind me of everything. But when I'm at work and I'm in that type of atmosphere, like that, when my brain is on, when it's work time, I'm at work, I remember everything.
Oh, you can remember license plates.
Yeah.
You can remember descriptions, horsepower. Right. So if you could explain, it would really help, I think, our listeners to understand the actual physiological and psychological mechanisms going on there.
Okay, let me share what I know, and because as a scholar, I do my best to speak well on what I know, and then when I don't know stuff, I just shut up.
Which is the opposite of cops.
So
fake it till you make it.
Memory involves the frontal cortex, and also the cortex, that's a thinking part of the brain. For when we think about that frontal cortex, that's a thinking part of the brain. But it also involves subcortical structures below the cortex. These are limbic system structures. And the ones that you guys should be familiar with is the amygdala and the hippocampus. Right. The amygdala plays a huge role in fear learning, the acquisition of fear. So they have done lots of research. They put a probe in a cat's brain and then expose it to a dog, and that it lights up like crazy. So the amygdala is very much related to fear learning and fear reactions, and the learning of fear. So learning to be afraid of dogs, learning to be afraid of spiders involves the amygdala.
And the amygdala is like the reptile brain, right? That's what they call it, right?
It's the lower brain. It's part of the lower brain, yes. You can call it a reptile brain, but yeah, it's kind of loose language, but it's a subcortical structure. It's below the cortex.
Yeah, yes. And so if I'm understanding what you're saying is that the just fear, just the fact that it's scary automatically shoots straight through all the other higher functions and gets you right at the core.
And so these fearful experiences, these traumatic experiences, they are more likely to cause tremendous activation of the amygdala and cause a greater activity over the brain generally. But I don't know the specifics of that. But I know, a general memory, like of my memory of this experience today, although it's novel, so it's more of my brain's going to be lit up because it's novel, my podcast.
Right.
But
well, welcome. We're glad we're
I'm about my virgin experience. Thank you for being gentle. But the day-to-day experiences, a conversation you've had that's so similar to so many you've had in the past, there's not going to be great activation of the amygdala. The hippocampus plays more of a role in remembering general information, like what you guys have told me recently or shared recently. My memory for that, I'm relying on, the hippocampus, a little bit of the amygdala. But if it's a traumatic experience, the amygdala plays a major role.
So if, I guess, the scarier or the more traumatic something is, the more it goes down deep, and,
yep.
as opposed to being a superficial experience, so I guess I'm trying to figure out a way to ask this. So
it even goes beyond cognitions. It goes beyond thoughts. Just the reaction of, like, when if in a PTSD vet, they could be in a support group and a picture falls onto the floor and crashes. All those vets are going to be, they're going to be tense and angry or anxious, and then angry and pissed. It's like it signals that. It brings them right to that feeling that they have. The intense anger, the emotion.
And that's a biochemical release, right? So the amygdala, the response releases those chemicals, so you don't have any control of it. Those chemicals just get released.
Correct. Yes. It's just a physiological signal, more at the level of cognitions. We could use cognitions to settle ourselves down, just to remind ourselves, okay, that was just a painting falling. Everything's okay. We're all right.
Huh.
So do you think, because of the experiences that people have had in traumatic situations, and when you take them now out of it, do you think that they're going to and this is, I guess I'm still going with this memory loss thing, do you think they're not going to remember things because it's just not reaching a peak, or it's not reaching what they've felt in the past? I don't know how to ask that. And I guess this comes to with me forgetting. I forget a lot of things. I have to write things down 2 or 3 times. I have to have my wife constantly remind me, and and it didn't used to be that way.
You're speaking of, you're not talking about traumatic memories. You're just talking about being at home and not remembering things.
Yeah, pick up dog food.
Yeah, exactly.
Right.
Yeah.
That's interesting. I can't speak to that. I could also, but I could tell you I'm 53 years old now, and my short-term memory is changing.
Yeah, well, John's not even 33 years old.
I find it to be a common thing with a lot of buddies that I've had in the military.
That's so. I don't know the answer, but the question you're asking, as I would word it, is for young combat vets who've had a trauma history, is their short-term memory impaired relative to other young men? Yeah. And that's an open question.
Okay, that's a way better way to word that question. Yeah.
So then,
thank you.
Now, I guess this would be my next question: is if you're saying you can remember stuff at work, do we train ourselves in some degree? Do you think that I'm at work, I need to switch on these functions, and then when I go home, I have to be on such a knife edge all the time at work? I'm just going to disengage that part of myself deliberately. Mm-hmm. Is that maybe?
I don't know. I think maybe it's that you remember. Memory is predicated on attention and focus. Maybe at work you're more dialed in and more focused.
Well, for sure.
Yeah.
When I'm at home, I'm relaxed and easygoing, so I'm not as focused. So my short-term memory may not be as strong. Still, even at 53 years old, when I'm seeing clients, I remember every detail of what's going on with them,
Yeah, same.
And then I may not see them in 10 years. They come back and the memories start to come back.
Right.
So I think maybe if I were to hazard a guess, it probably has something to do with your level of focus at work has to be so high,
right,
and so attenuated that like anything, the peak is so sharp that the valley is going to be just as sharp. So when you turn it off, it not only goes off like it doesn't go off like a normal person, it goes way off.
Yeah. Also, I'd imagine adrenaline. You go into a house and there's potential suspects in there. You are so focused and so intense that you are. I would imagine that your memory for that experience, at least in the short term, your ability to recall what happened an hour after, is going to be much better than if you went into a situation, had a casual conversation with somebody.
Sure. And we might just purge those things, as your brain is trained to remember so many important details that by the time you get to the non-essential shit, you just purge it.
Yeah, pretty much.
Yeah. Try to let it go.
Yeah.
That's the part of coping that I try to relate to. I'm trying. You think about the things that happen during the day at work, and then I'm looking to get away with it with distractions. Video games, and working out. And
the video games. And John's working out. That's coping for John. He loves working out. So, and this might be, I can speak to this from our perspective, but I'm curious from your perspective, why is there such a stigma to veterans and police officers and firefighters if you've talked to many of us, is there this running thread or this running idea of why there is such a stigma, or why we are so hesitant to reach out and put up our hand and say, okay, I'm struggling?
Mm-hmm. I would say that stigma follows from culture. So we're speaking of police culture and military culture. That's getting into a bigger discussion of the cultures of police departments, the culture of the military. Military it doesn't have the best interest of the soldier at heart. You're a government issue. You're a GI.
Yeah.
You're like a rifle. You're like a knife, and you're a human. But they think about your human qualities. They're not thinking about, is this experience going to be good or bad for John? That's not the issue. So,
and to be fair, for the military to do its job effectively, it can't think of John's well-being.
Exactly.
Right.
Exactly. Yeah, of course.
Yeah, that makes sense.
Job number one is winning the battle. That's right.
Right. That's why they give you a number.
That's it. Just a number.
Just a number.
Yeah. But true. Now, because I want to make sure that I have a chance to say certain things.
Sure.
Yeah.
For like treatment.
That was going to be my next question.
Okay, so exposure therapy involves a couple of things, and sometimes you'll see it. It might be called prolonged exposure or exposure therapy. There's other interventions that involve exposure, like EMDR, which was eye movement eye movement reprocessing. But they're all basically exposure therapy. Basically, it's the person, after you build up coping skills, teaching them, different ways, strategies for coping with their emotions. Somatic strategies like progressive muscle relaxation, learning to tense and relax their muscles in different body parts so their body gets calm, or diaphragmatic breathing, learning to breathe through their belly. So you learn coping skills, and then you start to talk about the trauma. And I mentioned graduated exposure. You would go first the less severe traumas, but there still might be rather severe. And the person is talking about their trauma for 25, 30 minutes. You want it, the exposure trial should be at least 25, 30 minutes, because during the time they're talking about it, you're hoping that their physiological reaction goes up and then peaks and then comes down, and that ideally their body is calm when they end talking about the trauma. So again and again, you're talking about the trauma, and hopefully your physiological reaction to it, your emotional and physiological reaction to it, is coming down as you end the discussion of the trauma. And that's exposure therapy. You're talking about it over and over again as much as you need to be able to talk about it and not feel as affected.
So that seems to be a running theme in a lot of these therapies, which is to have sustained engagement in the topic or the activity or the exposure, and yet get to a point where you've moved past the anxiety and the anger and to a state of calm. And that act of getting to the state of calm while still experiencing whatever it is key to the deprogramming or the reprogramming of what their brain's already done to itself. Mm-hmm. Is that, I mean, am I getting it right? I'm trying, because I know we've got a lot of people that are gonna be like, what does that mean?
What happens on a neurological level, I couldn't speak to, in terms of that. But what the hope is that by being able to share their story with a therapist or in a group format, that they're sharing their story over and over again, and because the body can only burn hot for so long, mm-hmm. so in that 25-30 minute arc, that they're able to tell their story, that ideally they would be still telling their story and their physiology would be on the decline. They would be calmer as they're finishing their story.
Have you found this to be the most effective way to treat PTSD?
Well, not just me, but the literature tells us that. The research tells us that. Now, and one word about that too, I want veterans and police officers to hear this, is that ideally you would get into therapy right away.
Sure.
That the longer the delay, the more permanent the PTSD effects. So traumatized on Tuesday, they should be ideally getting into counseling ASAP. They see really, really good results with exposure therapy if it's within 6 weeks. Mm. But if it's been 5 years, 10 years, 20 years, the effects are less, much less.
So you're more likely to have success the sooner even if you're not diagnosed with PTSD, the fact that you've just experienced something that's giving you nightmares, anxiety, all that kind of stuff, even if it's still acute stress disorder, still the thing to do is to reprocess it, to do exposure therapy. And so the simple language is the sooner the better. So then you're right as far as culture goes, because a lot of cops, and I experienced this myself, if you don't want to ask for help, because if you do, they're going to take your badge and gun.
Right.
Exactly, because asking for help is a unique experience. But what if in a certain police department it was mandatory that once a week all the guys were in a supportive group therapy and all the guys talked about it? All the guys talked about whatever shit they saw that week. And it didn't. Therefore, there's no stigma because everybody goes to the group.
That's true.
Yeah.
Well, what's funny is, I mean, what we've experienced just with this podcast, and we're coming up on 1 year, so yay us. We have put these stories out there, and we've seen that it's kind of therapeutic for us to tell them to each other.
Sure.
But we've also gotten messages from people that are veterans. They're the only veteran they know in their little area, or they're a police officer in a small department, and they're only exposed to what their other buddies are exposed to, and maybe they don't talk about it so much. But when they hear so many people from so many different backgrounds, whether they're veterans or firefighters or cops or whatever, and they say, "Oh, that's me. That's me. I feel like that. I've experienced that. Oh, I get that joke. That seems to be this, like,
and that gives them relief.
Yes, I'm not crazy. There's nothing wrong with me.
Yeah, yeah. There's a wonderful sense of relief that one gets when you realize that what I'm going through is normative, even if it's not necessarily healthy. Even if it's a room full of police officers all saying, yeah, occasionally I have a nightmare. And they all agree, oh, yeah, me too.
Yeah.
That helps people.
We always joke that there's only 3 types of cop nightmares. There's the one where your gun doesn't shoot, the one where it shoots but it doesn't have any effect, or the one where the trigger doesn't...
Can't pull the trigger.
Can't pull the trigger.
Really, and those are common. They're very. You guys.
We literally joke around with each other. Which, when you say, "Oh, you have a cop dream or a cop nightmare," which one do you have? And inevitably,
and everyone's got one of those.
Yeah, one of them. Like mine is always. It's always when I pull the trigger, the gun goes bang, and nothing happens. It's not effective at all. No bullet holes. No. And I pull the magazine out. I check the bullets. I put it back in. I rack around. I pull the trigger 2 more times. No effect whatsoever. I might as well be shooting blanks. And yet I talk to other guys. They're like, oh, no. Every single time I go to pull the trigger and it's like I don't have enough strength and I'm too weak. It's too hard. And then other people, no, I pulled the trigger and it's fine, but it goes click, 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 click. There's bullets in it, but it just goes click, click, click. Nothing happens. So it's a
trip. That's a trip.
It's very weird, but it always seems to be one of those things.
And in terms of being able to share that and know that it's normative, it goes to the value of a support group. It also goes to the value of podcasts like this one, where a veteran or a police officer might hear you guys talk like this and say, oh my God, I'm not alone. Very valuable. So,
and last question, and then we'll give you a chance to tag up on anything you maybe didn't get to say or wanted to say.
All right.
What would be simple strategies that police officers, firefighters, and veterans could employ maybe while they're deployed, maybe while they're on the job, maybe when they come home from deployment, but they're still, they're on vacation, they're still in the military. Anyway, these little everyday things that they might be able to employ in their life that would mitigate or, I guess, relieve and prevent this from building up and becoming a full-blown case of that.
That's a very good question. I would say it's a combination of the coping strategies and the exposure, but it doesn't have to be like a formal psychotherapy exposure therapy. Rather, what I would maybe suggest is that that police officer would have their coping strategies at home. That they take them out of their head. They go work out. They have lunch with a friend. They have activities. They play video games. They have activities that get them out of their head. They have activities that calm their nervous system. And even, so I mentioned video games and working out, more masculine stuff. But, there's a lot of value if we can get away from the stereotype. My wife was inviting me to go to yoga. I've never been to yoga. Because I think I'm too much of a butch guy to do it. But the literature tells us that certain activities like yoga, mindfulness meditation, they're very calming to the nervous system. So that police officer, you could play video games, you could work out, but even if you were willing to go to a yoga class and see what benefit you derive from the yoga experience.
So fishing.
Yeah, sure. Fishing, if that works for you.
That's my thing. No, that's what I do. That's my thing.
Yeah, that's working out and fishing.
And helps you feel calm, and that's your meditation. We can all have meditations,
Honey, I need to go meditate with a 12-inch bass.
No, but I think it's finding it. You got to find it.
And Thomas, I know you play. What's the NHL?
I'm a huge hockey fan. Huge.
I remember that. You see, talking about me, remembering people. I remember that you play it. I play the show. That's a baseball game, and I play Madden football. Mm-hmm. And when I'm playing that game, I'm not thinking about anything else in the world other than trying to get that hit, or get that batter out. And that's meditation right there. Because that's what we're doing in meditation. In meditation, you're looking to think about nothing but your target. In mindfulness meditation, you're focused on the tip of your finger and trying to block out everything else. Bills, bad relationships, and you're just focusing on the somatic experience. The tips of your toes, the tips of your fingers, your breathing, whatever it might be. But the modern meditation, the American meditation, is Netflix, Hulu, and video games, and going golfing. Why do physicians, why do surgeons golf? Because golf takes great focus. In the morning, you do open heart surgery, and that patient may die or not. But you go on the golf course, and all you're focused on is hitting the ball.
And no one's going to die.
Yes, exactly. It's their meditation. They're away from the troubling thoughts.
So what you're saying is next time I'm playing NHL and my wife gets mad, honey, I'm meditating.
But yes, Yes, but we shouldn't do it excessively.
Right.
1 hour per night, Mm-hmm.
There's going to be a lot of wives that are going to hate this show.
Because we still have time, time with our family and our...
Of course.
So basically, find your fishing. Whatever that is thing to, what was that movie, City Slickers, where the guy holds up his finger and he goes, life comes down to one thing, just one thing. And Billy Crystal says, what's the one thing? And the guy says, that's what you have to figure out.
Mm-hmm.
You got to find your one thing. Well, I'm going to give you a chance to say anything. If you have books to plug or if you have comments you want to make, the floor is yours.
I have nothing to plug. But as I was saying, in terms of the coping skills for veterans or coping skills for a police officer, fire officer. It's having our meditations, whether that meditation is fishing or working out or even a formal meditation like mindfulness meditation, that it's nice to have those coping strategies. We also have a little bit of exposure when you're willing to talk to your other police officers who are confidants, people you trust. And you can share experiences like, shit, this happened. X, Y, and Z, and they say, oh my God, and they listen to you, right? Mm. This confidant could be a fellow officer, could be a friend, could be anybody. And then the last word is, if you need professional help, don't delay, the sooner the better. If you really realize that the symptoms of PTSD are upon you, recurrent nightmares, distressful memories, if the symptoms are very apparent, then don't delay in seeking help, because therapy works, but exposure therapy works better the sooner you get in.
We appreciate you coming on. I know we're going to get some good feedback. We're already getting people that when we solicited people, for what they wanted us to get out of you. And we got a lot of people like, I don't want to tell you a question or anything. I just can't wait to listen to what he has to say. Yeah. So I know people are going to be excited to hear this. And if you don't mind, if at some point down the road, we get some feedback and people have some specific questions, we'd love to be able to have you back on and try and see if we can pick your brain again. I think he should start his own podcast.
Yeah, you should definitely start.
Seriously, everybody has a podcast these days.
If we did it, you could do it.
That's right. So
you guys have great equipment. I'm impressed with your setup there.
It's taken a year to. We started out with 2 cans and some shoestring.
That's it. And an internet connection.
Yeah, and anybody that's listened to our early on episodes knows we had audio problems and stuff like that. But we figured it out. But I really appreciate you coming on and saying all this. And the goal of this has always been just to kind of open people's eyes to what we go through, and then also to make the people listening to it feel like they're with their buddies. They've got the camaraderie. So, hopefully that's what's happening. And then hopefully they'll hear what you've had to say to us, and they'll learn something. And if even one person reach out to your car partner, reach out to your shift partner, reach out to the guy at the station house, the guy at the fire station that you trust, anybody. Your battle buddy, whatever. And those are the people that are going to go, yeah, man. Yeah, I get it. And even if that's all you get out of that conversation is, yeah, I get it, it's going to help. You're not going to feel like an alien.
Right.
So, yeah. All right. Well, Doc, thank you for coming on. We appreciate it. And hopefully we'll talk to you soon, and we'll have you back at some point to answer some of these questions. But you enjoy the rest of your evening, and thank you for being with us.
Thank you.
Okay, take care, guys.
All right, bye-bye. Wow, that was...
Very interesting.
Very interesting.
Yeah.
There was some stuff that I mean,
a lot of things that went over my head, but once it got broken down, I mean, it made a lot of sense.
Right. I think the big takeaway is going to be the same thing, which is just talk to somebody.
Yeah, something we don't already know, but it's something that we want to continue to just drive home.
Yeah. But what's nice is we got some answers to some of the neurological, physiological, biochemical. Mm-hmm. When my wife gasps and startles me, and I get angry, like literally beyond irritated. Like, what the heck? You know, I know it's just the way my brain is wired, and I've told people, I say, you understand, like certain responses I have is it's not like I want to be a dick about it. It just,
I agree.
It's just what happens.
I agree.
And I'll come back and apologize later. Maybe.
I was going to say maybe.
Maybe. How can people find us? We always say that.
Hit us up on our website.
Yep.
Hit us up on
warstoriesofficial.com.
Instagram.
Yep. You can just type in War Stories Official.
Hit us up on Facebook.
That's right. And people have.
And you guys continue to hit us up on Facebook and our Instagram and our website and on all these platforms that you guys listen to our podcast on, and giving us these awesome ratings. And we do read them, and we do appreciate them.
And it may take it because John's got a day job and I've got a day job. It may take us a little bit of time sometimes to respond, and sometimes we're already on and we can respond right away.
But even if you get a like on your comment, that's us.
That's
we're
us.
Doing it.
That really is us. That's why we don't have someone else running it. It's so if you're talking to somebody on our social media, it's one of us.
Yeah.
And we get people saying, well, I'd love to come on, but I don't think I have anything that interesting. Yes, you do.
Yeah.
Yes, you do. Whether you're a firefighter in Decatur or you're a police officer in lower bumfuck Egypt, and you deal with, vehicle versus cow all day, or I'm telling you.
And we got guys coming up that are from the Midwest.
Yeah, we had somebody hit us up that said, hey, if you all want a rural police officer's perspective, I'm in, and
we're going to give it to you.
Absolutely, because it's not, this show isn't just about, certain big city cops and certain big city agencies that, because we know them, we've had them on and all that kind of stuff. But in fact, next episode is going to be my father talking about the Wild Wild West heyday of the Los Angeles Police Department.
Throwback.
Yeah, for real. I kid you not, guys. My old man's going to come in and sit down. When he came on the job, number one, Adam 12 was still on TV, and number two, he didn't have a radio on his belt because they didn't exist.
Was he on when they would let him go into the field in the academy, before they get him into the They're just here you go.
Yeah, they swore you in day one.
Yep.
And you were at the academy, but the reason they swore you in day one is because if they had to deploy you,
you were getting used.
You were getting used.
Yeah.
So it was
awesome.
it was a good times and crazy times and bad times and all that kind of stuff. So that's next week. But your story, the ambulance stories from small town America, or the firefighter stories from the Midwest, or the police stories from Maine, or wherever you're. Hell, we've had people from New Zealand, in Australia. One gal said, I can't, due to legal reasons, come on and share my stories, but appreciate it. If you're in another country and you're listening and you want to share your experiences of law enforcement, firefighting, or the military of another country, hit us up. We'll figure out a time zone.
We'll make it work. Even if you got a short story, you don't want to come on and you just got something you want to share.
Something you want to share, send it to us. We'll read it.
We'll say it.
We've done it before. I know. I've seen me do it.
I've seen it.
And so, do we have anybody we want to dedicate this episode to?
So for this episode, we are going to dedicate it to two Special Forces soldiers, Sergeant First Class Javier Jaguar Gutierrez and Sergeant First Class Antonio Ray Rodriguez.
By the way, Jaguar. Fuck yeah. That's a cool name. That's a cool last name.
Hell yeah. He earned that.
Yeah, you did.
Yesterday, a Special Forces team was ambushed in Afghanistan by a rogue Afghan policeman. I have actually seen that myself, too. 2 American commandos have been killed and 6 wounded. In addition, at least 8 Afghan commandos have died as a result of the attack as well.
Yep.
So, here's to you, too.
Rest easy. We've got it from here. Well, I'm looking forward to our next episode with my old man. We will also be recording a second subscriber-only episode because we will be discussing the Rodney King incident and the aftermath due to my father's involvement in the investigation of it.
And not only will we be talking about that, but we will have members
Yes.
of the department here
Yes.
to get in on it.
Yes.
These are members that you may or may not have heard on our podcast.
Yes. And my goal, just so you guys are aware, my father was like, hey, I'm not cool like getting up, sitting down and kind of just, bashing these guys. I said, no. We're not trying to bash the people involved. I think for those of you that are going to subscribe and listen to it or already are subscribers, the goal is to kind of debrief what the public knows about what happened versus what the investigation determined happened.
Right.
And the aftermath, was it warranted or was it overblown? And how did it affect law enforcement moving forward? I can tell you the first thing we're going to talk about as far as affecting law enforcement moving forward is the videotape culture of get your video camera out and film something. So we're gonna be talking about that. That's subscribers episode. If you don't know how to become a subscriber, there's a couple of ways you can do it. The first is you can become a patron, and you go to Podbean, you become a patron of the podcast, and then in your feed, you'll automatically be allowed to listen to the locked subscriber-only episodes. The other way to do it is to go to our website, warstoriesofficial.com, become a member of the website and the briefing room where we post all of our comment sections, which is starting to grow. People are starting to post in there. It's my goal with setting that up, and John kind of jumped on it and said, I like this idea. And so we went forward with it. My goal was initially to kind of set up a private social media for, police officers, firefighters, military veterans to post about things that are going on privately, because we all know if you're in that community, any first response or veteran community, and you post the wrong thing on social media, you could get fired, you could get demoted, you could get court-martialed. There's all kinds of bad shit that can happen to you. So this is a place where the only people that are going to access it should theoretically be supporters, and it's private, and your comments are private, and you have to be a member to get in there. That being said, I also want people to be able to post their stories. I want them to be able to post, hey, I was in, this unit, and maybe somebody from that unit's like, hey, oh my God, there you are. I haven't talked to you in forever. So that's one of the cool things that I hope our briefing room will do. The other cool thing is when you're a member, I post the subscriber-only episodes in there for you to download and listen to. So those are the ways you can get those. Other than that, we just appreciate all the support as we're coming up on the 1-year anniversary of the podcast.
Yep. And we'll be giving things away.
We have a giveaway coming up.
And it's not 511.
It's not 511. So watch our social media, check Instagram, check Facebook for that. And until our next episode, come home with your shield or on it.